for joining. We have a special meeting today with a limited agenda, but an important one. It is to approve the plan benefit designs for the next calendar year. And hopefully it's a fairly straightforward agenda because I understand there are not so many changes this year, which is great to hear. But let's begin by just asking Marcin, if you would just do a roll of the directors. This is Charlie Klippel.
Yes, Mr. Chair, but before I do a roll call for attendance, I would just like to mention that this meeting is being recorded for the minute-taking purposes, as well as posting of the recording on the agency's website. This meeting is also being live-streamed on the Access Health CT website. It is also requested that participants introduce themselves every time they speak, and roll call votes will be taken for every action item. A roll call for attendance, Charles Klippel.
Yeah, here. Thank you.
Paul Philpott.
Here.
Graham Ritter.
Here.
Dr. Deidre Gifford.
Present.
Thank you. Stephen Hernandez. Matthew Brackman. Thomas McNeil.
Present.
Thank you. Dina Berlin.
Here.
Thank you. Commissioner Andrea Barton-Reeves from DSS.
The commissioner may be on a phone call. Peter Hadley here. I can fill in for her if she's unable to attend.
Thank you,
You
Deputy
just sent us a
Commissioner.
note saying she'll be a minute or two delayed.
Okay, thank you so much. Sean King from OHA.
Here.
Thank you. Claudia Gaultier from OPM.
Here.
Thank you. Paul Lombardo from SID.
Here.
Thank you. Dr. Manisha Tutani, DPH Commissioner.
Here.
Thank you. And Caroline Zambetti, designee for Nancy Navarrete, DMS Commissioner.
Here.
Thank you so much.
Thank you. And if we could ask the members of the Access Health team to introduce themselves as well. James. James, hello.
You're on mute.
I'm sorry. Good morning, all. James Michelle, Access Health Connecticut.
Gina Walsh, Director of Operations, Access Health Connecticut.
Good morning, Holly Swick, Director of Finance, Access Health Connecticut.
Hey, good morning, Rebecca McClear, Director of Technical Operations and Analytics with Access Health Connecticut.
Good morning, Caroline Ruette, Director of Marketing, Access Health CT.
Good morning, John Carbone, Director of Small Group Product Development and Broker Support.
Good morning, Tammy Hendricks, Director of Health Equity and Outreach, Access Health Connecticut.
Good morning, Marquise Davis, Director of IT, Access Health Connecticut.
Anyone else?
Good morning,
All right.
Kelly Cody.
Oh, sorry, Kelly. You're an important player on this meeting, Kelly, so thank you.
Thank you.
I understand there are no public comments. Is that correct?
That's correct, Mr. Chair.
Fantastic. So we'll just move to the agenda. The first agenda item of which is to approve the minutes of our last meeting, January 18th. So is there any discussion of the minutes from the last meeting? Hearing no discussion, could I have a motion to approve the minutes of the January 18th meeting, please?
Yes, this is Grant. Motion to approve.
Thank you, Grant. Second?
Paul, second.
Tom McNeil, second.
Thank you. We'll take Paul. Charlie Klippel, yes.
Thank you. Paul Philpott.
Yes.
Graham Ritter.
Yes.
Deidre Gifford.
Yes.
Stephen Hernandez. Matthew Brackman.
Yes.
Thank you. Thomas McNeil.
Yes.
Dina Berlin.
Yes. Yes.
Deputy Commissioner Peter Hadler from DSS.
Yes.
Thank you. Sean King.
Yes.
Thank you. And Claudia Gaultieri.
Yes, thank you.
Thank you.
Terrific. Okay, Kelly, I think the floor is yours, along with Julie Andrews from Wakely. Thank you again, Julie, for joining us. Please proceed.
Excellent. Thank you, and good morning to everyone. I'm Kelly Cody, the Carrier Product Manager for Access Health, and I'll be presenting along with Julie Andrews from Wakely Consulting on the 2025 Standardized Plan Design Recommendations. And those are for both the QHP and SADP products, as recommended by the Health Plan and Benefits Qualification Advisory Committee, which I will refer to as the HBBQ from this point forward. As many of you are aware, the participating members of the HBBQ represent a variety of backgrounds and interests. We have community healthcare advocates. We have representatives from each participating carrier. We have a member from DPH. We have also have a member from the CID, the Connecticut Insurance Department, offering their expertise along with the members from this very board of directors group. This diverse membership allows this committee to have meaningful conversations and provide thoughtful recommendations when faced with the challenges of having to make plan design changes that are typically impactful to a consumer or our consumers. Their main objective is to provide benefit recommendations for the standardized plans that meet both federal and state requirements, but continue to offer quality healthcare options to the residents of Connecticut. Before we get into the heart of the discussion, I would like to take a few minutes to provide a quick overview of the certification workflow timeline. Existing and potential issuers are advised of the Access Health certification requirements through the QHP and SADP issuer solicitations each year. These documents provide a summarized outline of the Access Health and federal requirements, as well as providing the standardized plan design options, which we are about to discuss. Based on that guidance, any issuer that forwards a completed notice of intent to participate on the exchange will then receive an issuer application, which then includes timelines, detailed requirements, all the required forms, tools, and instructions in support of their request for certification. All issuer applications are due back to Access Health on the same date that the rate and form filings are due to the Connecticut Insurance Department. And again, this year it will be June 1st, 2024. So in order to provide our issuers enough time to respond to the application, Access Health targets the release of both the QHP and the SADP solicitations shortly after receiving the Board of Directors approval for the HBBQ Advisory Committee plan recommendations. With that said, we will be seeking board approval for the recommendations from the HBBQ on the standardized QHP and SADP plans for plan year 2025 during this meeting today. It's important to note that federal guidance pertaining to the maximum out of pocket, the actuarial value calculator, the IRS regulations have not yet been finalized. Additionally, state legislation sessions end in early May. So given the need, though, in order for us to move forward, we will be presenting information based on what we know today. And if necessary, we'll adjust once final guidance is made available. If the proposed plans are determined not to be in compliance with the federal guidance, this could result in the need to bring the standardized plans back to review with this board in the near future. So with that said, we'll get into the standardized plan development view that's in front of you. This committee met in January and February to review and discuss potential plan changes for the upcoming plan year. I believe back in January, during the January board meeting, Susan had mentioned that Wakely and the issuers had already started the process of testing the QHP plans, using the 2024 plan designs and putting it into the 2025 draft actuarial value calculator to determine the 2025 values. This process is really the starting point for the group to determine right off the bat if the plans remain compliant with the de minimis ranges that are presented by CMS each year, and if the plans also stayed in compliance with mental health parity rules. Because CMS updated the underlying data, which is used within the draft calculator, this resulted in an opportunity to lower some member cost share amounts under a few of the standardized plans. Julie will provide more details further within this presentation, but we are super excited to have this unusual opportunity to reduce member cost share, which in turn will benefit the consumer. For the SADP products, there's a little less rigor around when reviewing those plan designs. As we've discussed in previous board meetings, annually CMS does develop and communicates a new annual maximum out-of-pocket amount, and that's based on the U.S. Department of Labor Statistics Consumer Price Index, or CPI, using specific dental services. So the group did review those plans, and I'll go into that information a little bit further within this presentation. Before we move to the next slide, does anybody have any questions with what I've rattled off?
Nope. Sounds good. We're
sounds
enthusiastic
good. Okay.
too about your changes, so go for it.
We're very excited. I am. This is the first time we've had this opportunity to do this. So the 2025 regulatory variables, Julie is going to go into the regulatory variables that are related to CMS and the IRS. But here we wanted to just mention that the enhanced subsidies remain available through 2025. So from a federal standpoint, that's all I need to discuss. And then from a state standpoint, again, just mentioning that I had mentioned earlier that the state sessions end in May. The specific date is May 8th, 2024. So at this point in time, there is no legislation having any impact to the 2025 plans. But I guess we can't say, there will be no impact until session closes. Okay, next slide, please. Proposed 2025 plan mix. This information on the slide represents the plan mix for individual and small group medical and dental plans that are offered through the exchange. The left side of the slide shows the medical plans at each metal level and the number of plans carriers are required to submit, as well as the number of optional plans they may submit. For the individual market, Access Health requires that each carrier submit 4 standardized plans, but allows each carrier to submit at least 9 additional non-standard plans, totaling to a maximum of 13. For SHOP, there are no standardized plan requirements, but carriers must submit a minimum of 5 plans that include certain perimeters, such as including in and out of network coverage, pediatric dental EHB coverage, things of that nature. We also request that require that they offer 2 silver and 2 bronze plans, of which one must be HSA compatible and the other not. And a carrier may offer an additional 15 plans, optional plans in small group, allowing a maximum of 20. On the right side of this slide, it displays the plan mix for the dental plans. There's no difference in plan mix requirements across the markets. Access Health requires that each carrier submit 1 standardized plan with the option to include or exclude out-of-network coverage. And a carrier may offer an additional 3 optional plans, totaling to a maximum of 4. Because no carrier offers the maximum amount of plans in either individual or small group QHP. The committee felt that the present count of permitted plans is sufficient, so therefore the HBBQ is not recommending any changes to the medical or dental plan mix in either market for plan year 2025. So before I move on to the next slide, are there any questions with regards to the plan mix? All right.
Thank you.
So moving on to the 2025 standardized plan designs for the SADP or the standalone dental plan. This is the recommended 2025 standardized plan for the standalone dental plan. It's similar to the QHP maximum out of pocket. As I mentioned earlier, CMS does update that maximum amount annually. For your purposes, it's circled in blue, the two amounts. This limitation, just to ground set everyone, this limitation only applies to in-network services and to the pediatric portion of the benefit. It does not include any out-of-network benefits, and it does not include any benefits that are related to the adult coverage. It is also important to note, as long as the maximum out-of-pocket value that we have on our plan is less than the newly calculated maximum by CMS, we are not required to make any changes to that amount. So during the process of plan evaluation, this committee did look at the opportunity to increase the out-of-pocket maximum to match CMS's newly calculated amounts of $425 for one covered child and $850 for two or more covered children, by requesting that each issuer present the overall impact to the consumer's monthly premium rate. The impact to the premium rates were reviewed and considered, but because the impact had no significant savings to the member, the HBBQ Advisory Committee agreed to leave the plan as is and make no plan changes for 2025, leaving the maxes at the $350 for one child and $700 for two or more. So I believe at the conclusion of Julie's presentation, this group will vote on the HBBQ's recommended 2025 dental plans. So before I hand this presentation off to Julie, on the more exciting part, are there any questions related to the information I've presented at this point?
Julie, since there's no change in this plan, would you prefer we just go ahead and vote on the dental plan, or do you want to just do it in the order that you've laid it out? I think you're on mute.
I think with the way we have the vote set up, I believe that the dental will be the last item to vote on.
Fine by me. No, keep going. Let's go.
Can everybody hear me?
Yes, we can hear you now. Thank you.
Okay, wonderful. Thank you. All right. Well, let's go ahead and advance on to the slides. As Kelly mentioned, there's really 4 key components that we need to do the standard plan design analysis. And at this time, the 3 regulatory elements are still in a proposed format. If we go forward 2 slides, I'll just kind of give you a little bit more background on what those different components are. The first is the notice of benefit and payment parameters, and this is the regulatory document that really defines many of the plan elements each year, including the maximum out-of-pocket. as well as the cost sharing range variations. The second is the Federal Actuarial Value Calculator tool, which is the Excel-based model that is provided by CMS to measure the plan designs to make sure they fit within the metal tier requirements or metal level requirements. The third is the IRS regulation that comes out in May that defines the high deductible health plan, or the HSA limitations. The final element, which has been completed, is that we have the issuers, all of the issuers that are currently on the exchange, do their own internal analysis of the actuarial values as well as mental health parity testing, so that as we approve these proposed plans, when they go to file, we are can be assured that they will pass the rate filing with the insurance department. On the next slide are the changes that have been made for the maximum out-of-pocket. It is being decreased to $9,200 from the current year's $9,450, as well as the different cost-sharing variations, which are listed in the lighter blue section. So the benefit to consumers is that throughout the whole year, this potentially reduces their total out-of-pocket costs for healthcare cost sharing. The bottom portion talks about the IRS regulation, which won't come out until May, but the plans that we have proposed comply with the current 2024 limits. On the next slide are the changes that were made to the actuarial value calculator for 2025. One of the big changes is that they've updated the underlying data that is used to do the calculations and the analysis, and they've based it on the most recent 2021 EDGE data, which is actual national, individual, and small group experience. They've updated the underlying trends to 2025, since the data is based on 2021. You can see that they're anticipating medical trends of about 3 to 6.4% over these time periods, while pharmacy trends have been considerably higher with 4 to 9.9%. Certain updates have also been made to improve the federal tools, determination of the actuarial value, and some of these changes, in addition to the changes in the data, allowed us to make some more beneficial changes in cost sharing to consumers, which Kelly has already mentioned. And you can see those results if we go to the next slide. So the first row are the actuarial value ranges that the plans must fall within to ensure compliance with regulations. The second row is the final 2024 results for the plans that are currently being offered. And then the third row is those 2024 plans that were run through the 2025 calculator. And so you can see on some of the standard plans that the upper limit of those fell well below the top de minimis range. So for example, the gold plan has a top limit of 82%. But the 2024 plans were at a maximum 80.5%, so there was room to improve those plans. Alternatively, on the bottom table is the cost sharing reduction plans, and you can see that the 2025 values are shown in red, which means they've fallen out of compliance for one or more reasons, and so we did need to make changes to those plans to bring them into compliance. If we go on to another slide, these are just some additional services that have cost sharing associated with them, but because there's a little bit smaller buckets of services, they are not part of the actuarial value calculator. So I just wanted to make sure that everybody was aware that there are these additional services that do have cost sharing associated with them. On the next slide, just some additional notes as we're going through the plan designs. Services are for in-network only. There are out-of-network cost limits, but unless specified, we're showing the in-network rules. The deductible and maximum out-of-pockets are presented at the individual level unless specified, and family limits are 2 times the individual limits. And then just as always, preventive services are covered with no cost sharing for consumers. So that'll bring us to our first plan, our gold plan. And this was, as I mentioned earlier, this was one plan where we could make some improvements. And so we explored 2 options. One of the goals was to bring the laboratory services to not be subject to the deductible to align with the other plans. And we were able to do that in option 1, but we had additional room which allowed us to further reduce the deductible by $100 from its current level of $1,300 to $1,200. So you can see those 2 items highlighted, and the committee plan choice was option 2, to both reduce the deductible and to waive the deductible on the laboratory services. Let's go on to the silver plan. So the silver plan is a little bit counterintuitive. We did end up having to increase the laboratory copay from $20 to $25. And this is because of the relationship of the standard silver plan to all the cost sharing reduction plans that come after it. And because of the changes required on the 73% plan, it required us to increase the copay on the standard plan so we could bring all of the plans, all of the cost sharing combinations into alignment. So if you go on to the next slide, we'll show you that 73% plan. You can see the maximum out of pocket was reduced. We had it at the maximum last year of $74.75, but regulations are requiring us to reduce that maximum out of pocket to $73.50. This did require us to increase the deductible to $5,000 and increase the laboratory services copay to $25. So those items are shown in red, and those brought this plan into compliance. And the next slide is the 87% cost sharing reduction plan. This one was also out of compliance. And so it was a little bit different in that we had to reduce the cost sharing. So we've reduced the maximum out of pocket from $2,925 to $2,725. And we've also been able to reduce the deductible from $675 to $475. So those individuals at that 87% level will benefit from those lower cost sharing. On the 94% plan, which is the next slide, this is a situation where we actually needed to increase the maximum out of pocket by $100 from $1,050 to $1,150. And that is the option that's being proposed. I've gone through those silver plans pretty quickly. I didn't know if anybody had any questions. I didn't see any hands up or any comments.
Thank you. I think the changes look pretty simple, so we appreciate the review, and let's keep going.
All right, then let's go on to the bronze non-HSA plan. So there was a lot more room here to work into the bronze non-HSA plan. In option 1, we were able to lower the primary copay, care copay from $50 to $40. We were also able on the option 1 plan to reduce the generic drug copay to $15 and then convert the coinsurance for preferred brand drugs to a copay, as well as waive the deductible on those 2 levels. The other option that we looked at was just impacting the deductible and the out of pocket, which was option 2, where we reduced the deductible and the maximum out of pocket to $8,000. The committee selected option 1 because they liked the feature of being able to present more services at a copay instead of a coinsurance, which tends to be harder for consumers to prepare and understand what they might be paying for upfront, as well as, waiving the deductible on those services. So then the next plan and the very last plan is our HSA plan. It was in compliance. We chose to leave it alone at this time and not make any changes. And so that brings us to the end of the plans. And I guess I will turn it back to the Access Health team to manage the voting.
So this summary of recommended plan changes, this is just a visual for the group to see what the overall changes were by meta level. So it's just meant to be a useful tool as you, for you to summarize what has been changed, and then we could move on to the voting piece.
Yeah, why don't we keep that slide up? Just, oh, I'm sorry, keep going. Is there another slide you want to show us?
Nope.
If not,
that's it.
Let me ask if there's any discussion or comments from the directors. Before I ask that, let me take a moment to thank the committee, to the Benefits Committee, and particularly those of you on this board who also sit on the Benefits Committee for the work behind this. It is very nice to see modest and in some instances positive changes, but it's not easy to get there. So I appreciate all the hard work that you and the rest of the committee put in to get us here. And then let me ask for any questions or comments about the presentation that Julia just made before we consider voting on them. All right, well, hearing no comments or discussion, then Marcin, I'm just going to start in on the votes, if that's okay with you.
That's okay, Mr. Chair. We have 5 votes to take.
All right, and the first one is to approve option 2 as presented by Wakely Consulting on behalf of the exchange staff as the standard gold plan for plan year 2025. If there's any discussion, fine. Otherwise, could I get a motion to approve that plan?
Paul, so moved.
Thank you, Paul. Second.
Ibrahim, second.
Matthew, second.
Steve, thank you. Charlie Klippel, yes.
Okay, Paul Philpott.
Yes.
Ron Ritter.
Yes.
Deidre Gifford. Steven Hernandez.
Yeah.
Matthew Brackman.
Yeah.
Dina Berlin.
Yes.
Peter Hadler.
Yes.
Sean King.
Yes.
And Claudio Gualtieri.
Yes.
Thank you.
Thanks very much. The second vote is somewhat more complex. It's the silver plan sort of lumped together. So if I could have a motion to approve the standard silver plan option 1, the silver 73% plan option 1, the silver 87% plan option 1, and the silver 94% plan option 1 as presented by Wakely Consultant as the standard silver plan, and the silver variants for 73%, 87%, and 94% plans for the year 2025. So in other words, all of the silver plans that were presented by Julie. Any discussion? If not, could I have a motion on these plans?
Paul, so moved.
Thanks, Paul.
McNeil, seconded.
McNeil, Tom, thank you very much. Charlie Klippel, yes.
Okay, good, thank you. Paul Philpott.
Yes.
Ron Ritter.
Yes.
Deidre Gifford. Steven Hernandez.
Yes.
Matthew Brackman.
Yes.
Thomas McNeil.
Yes.
Dina Berlin.
Yes.
Peter Hadler.
Yes.
Sean King.
Yes.
And Claudio Gualtieri.
Yes.
Thank you.
The third vote is on the standard bronze non-HSA plan. So if I could have a motion to approve option 1 as presented by Wakely Consulting as the standard bronze non-HSA plan for 2025.
Paul, so moved.
Thank you. Tom?
Second, Grant.
Grant, perfect. Thank you very much. Charlie Clipple, yes.
Is there a discussion on the motion before us, Mr.
Oh,
Chair?
sorry. Is there any discussion on this plan? If not, then Charlie Clipple, yes.
Thank you. Paul Philpott,
Yes.
Grant Ritter,
Yes.
DJ Gifford, Steven Hernandez,
Yes.
Matthew Bachman,
Yeah.
Thomas McNeil,
Yes.
Dina Berlin.
Yes.
Thank you. Peter Hadler,
Yes.
Sean King,
Yes.
and Claudio Gautieri.
Yes.
Thank you.
Thank you. Our fourth vote is on the bronze HSA plan. Could I have a motion to approve and second the current 2024 standard bronze plan as the standard bronze plan for plan year 2025?
Paul, so moved.
Thank you, Paul.
Second, Grant.
Thank you, Grant. Any discussion? If not, Charlie Clipple, yes.
Thank you. Paul Philpott,
Yes.
Grant Ritter,
Yes.
DJ Gifford, Steven Hernandez,
Yes.
Matthew Bachman,
Yes.
Thomas McNeil,
Yes.
Dina Berlin.
Yes.
Thank you. Peter Hadler,
Yes.
Sean King,
Yes.
and Claudio Gautieri.
Yes.
Thank you.
And then finally, the dental plan, and we heard about right at the beginning of this conversation. Request motion to approve the current 2024 standard standalone dental plan as the standard standalone dental plan for 2025.
Paul, so moved.
Thank you,
Yeah.
Paul.
Yeah. Seconded, Grant.
Thank you, Grant. Any discussion? Charlie Clipple, yes.
Thank you. Paul Philpott,
Yes.
Grant Ritter,
Yes.
DJ Gifford, Steven Hernandez,
Yes.
Matthew Bachman,
Yes.
Thomas McNeil,
Yes.
Dina Berlin.
Yes.
Thank you. Peter Hadler,
Yes.
Sean King,
Yes.
and Claudio Gautieri.
Yes.
Thank you.
Terrific. That brings us to, I think, to the end of the approvals that we need to do. Really appreciate everybody's indulgence in doing this. Julie, thank you again for your work in doing this. Kelly, thank you for your leadership in pulling this together for us. We really appreciate it, and certainly appreciate seeing the plans that we have lined up for 2025. They look very good, so thank you. Any further discussion or comments, questions about the plans we have just approved? If not, then might I ask for a motion to adjourn this meeting?
Yeah.
Paul,
Motion to
so
adjourn,
moved.
Grant.
Thank you. Second?
Paul, second.
Thank you, Paul. Any discussion? If not, Charlie Clipple, yes.
Thank you. Paul Philpott,
Yes.
Grant Ritter,
Yes.
DJ Gifford, Steven Hernandez,
Yes.
Matthew Bachman,
Yes.
Thomas McNeil,
Yes.
Dina Berlin,
Yes.
Peter Hadler,
Yes.
Sean King,
Yes.
and Claudio Gautieri.
Yes.
Thank you.
Thank you all very much. I appreciate it, and happy to give a little time back under the circumstances. So thank you all.
Thank you.
Talk to you later.
Thank you. Bye now. Thank you.
Bye-bye now.
Thank you.
Thank you.